If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Today on To Your Health, it's all about the eyes. They're called the windows to the soul. In fact, the eyes can tell us a lot about ourselves, our emotional state, even our general health. That's why it's important to keep them healthy. Today, we'll talk to an ophthalmologist about some of the most common eye health issues, what you can do to prevent or treat them, and how your eyes might offer clues to other health issues. We'll also hear from a patient who's had successful treatment for cataracts. She'll share some of the things she had to consider when deciding on treatment options, things that we might want to keep in mind if we're ever diagnosed with cataracts. That's all coming up next on To Your Health. Hi, I'm Portland Helmich. Does your vision get blurry after sitting in front of the computer too long, or maybe texting on your phone? Is it getting harder for you to see when you're driving at night? Do you see halos around lights? If you answered yes to any of these questions, you should see an eye doctor because he or she just might be able to help. Joining us today to talk about eye health and some of the most common problems is ophthalmologist Dr. Eric Mann. Dr. Mann has been published in prestigious ophthalmologic journals and has his own thriving practice in New Jersey. Dr. Mann, thanks for being here.
Thank you for having me.
So we always say the eyes are the windows to the soul. Do you agree with that?
I agree. I mean, they're definitely the window to the rest of your body and your health. So yeah, you can see a lot by when you're looking at someone's eyes as to how well they're doing in their mood and even their happiness and other levels.
What is it about the eyes that made you want to pursue this as a professional career?
Well, I always knew I wanted to go into medicine and to help people. But it was a trip down to Florida where my uncle is an ophthalmologist. He's 17 years older than me, more like an older brother. And he has a very big, thriving practice with a lot of Hispanic patients. And I went down there and we go into a room and he talks to a patient and she says to him, Los manos del Dios, the hands of God. And I look and I say, Fred, I know who you are. What's this about? He said, well, yesterday she couldn't see and we did cataract surgery and now she can. And it was really impactful and it really made an impact on me and made me decide that that's what I wanted to do with my career.
To give people maybe the gift of sight or give them their sight back.
Exactly.
So what are some of the most common eye problems that you see today?
The most common eye problems are problems of aging and getting older with health issues. Typically, cataracts is a very common problem, like gray hair and wrinkles. We all get them, so it's just a matter of time. And I usually tell my patients when they get them that you live long enough, you've earned your stripes. Other problems are things with diabetes and high blood pressure. When we do a retinal exam and look at the back of the eye, those small blood vessels that are in the back of the eye are also very similar to the ones in the heart and in the brain. So we can see lots of signs of disease, literally the window into their body, just by looking. So
you can see that someone has diabetes or maybe is pre-diabetic?
Yes.
Either?
Yes. So if you see some narrowing of the blood vessels or golden coloring of the blood vessels, that's called atherosclerosis. That can lead to heart disease, heart attacks, strokes. Also, if you see little outpouchings or little spots of blood in the retinal exam, that's usually a good indicator that they have diabetes.
So you've had patients come to you and you've said, I'm sorry to tell you this, but I can see that you have diabetes?
Yeah, actually, in the older days, just even a few years ago, I would see that on exam and I would have to tell the patient. But now we have such good photography and cameras that I can show the picture on a screen to a patient and say, do you see how this looks a little bit different than maybe this normal one? And I can show this little spot of blood or this little area of hardening of the arteries is something that, even though I think you might have diabetes, still let's go back to your primary care doctor, get some blood tests, and confirm that you do or don't have it.
My primary care doctor told me that I should go to my eye doctor because my mother has multiple sclerosis. And she said that, the eye doctor might be able to see if I have the beginnings of that. Is that true?
Usually that's a little bit tough to see. The first signs of multiple sclerosis is sometimes called optic neuritis. and that's usually a lesion on the optic nerve. Usually you would present with the symptom, come in, we would examine you and confirm that that's what it is, versus you having it and not really knowing.
How often do you think we should get our eyes checked? Is it a yearly thing?
I think it's definitely an annual exam.
Annually?
Yes.
And if you don't get your eyes checked annually, what could be the danger?
Well, the danger is, sometimes ignorance is bliss, but then you don't know what's going on with your health. So if I can see signs, for example, I had a young patient just last week who was 43 years old, came in, she works in the healthcare field, just got her insurance and decided to come in to get an eye exam. And I was able to show her on the picture that her blood vessels looked a little abnormal, that there was some hardening of arteries at such a young age. We decided to check her blood pressure, and it was elevated. With that information, she was then able to go to a primary care doctor and get treated for her high blood pressure. She was walking around not knowing that it was elevated.
It's fascinating how all the systems of our body are so connected.
Mm-hmm.
So I want to talk about cataracts. There's a statistic here. According to the American Academy of Ophthalmology, more than 24.4 million Americans, you're probably aware of this, age 40 or older have cataracts. And by the age of 75, half of Americans are going to have them. So what does it mean really to have cataracts?
Great question, because everyone gets freaked out or worried when they're told that.
I think of it as like some film over the eye, but I don't know.
That's the conception, but it's a misconception. So basically, we're all born with a lens inside of our eye. It helps us to focus and to see. And usually at around age 40, that lens loses its flexibility and we start needing longer arms or reading glasses to help us with that. As the lens continues to age, it starts to get gray and sometimes even brown. And it's that discoloration of the lens that we now call a cataract. Sometimes as that cataract is growing and advancing, we can treat it or rectify the problem with some glasses, like the reading glasses or stronger glasses. But eventually, when the lens gets too cloudy, we then have to remove it.
And this is a problem of aging. It's not our diet. This is going to develop if we live long enough.
If you live long enough, everybody gets one 100%.
Wow.
Doesn't matter race, ethnicity, where you live in the country. Now, there are certain things that can make these cataracts grow faster and happen at earlier ages. The big one is UV light exposure. So I highly recommend using sunglasses with UV protection. That can slow down the process. Another thing is smoking. Smoking, besides having all other bad health effects, can also make the cataract grow at a faster rate. Other things could be even trauma to the head or to the eye, and also steroid use. And I'm not just talking about bodybuilder steroids. I'm talking about steroids for inflammation that people take for joint pains. And a very common one that's coming up now is over-the-counter nasal sprays.
Huh.
A lot of them have steroids in it. They're over-the-counter. People take them without really thinking they're taking anything medicine-related for themselves, but they take it for sinus infections or stuffy noses or allergies. And I'm seeing lots of young patients who have been taking these nasal sprays for 6 months or a year, developing cataracts.
Wow. So talk a little bit about the treatment for cataracts. I know there are sort of two main ways to treat it.
Yeah. So basically, the treatment for cataract is surgery. And we have a couple different options nowadays when comes for cataract surgery. Firstly, the traditional method is using blades to make incisions into the eye. We then have to make a little opening into the sac where the cataract is. And then we use an ultrasound device to break up the cataract, suck it out, and then we put a new lens in. The newer technology in the past 2 to 3 years has been the use of a laser to do lots of the parts of the procedure. That means without any blades, the laser makes an incision into the eye. It makes a perfectly round opening into the sac of where the cataract is, and it softens up the cataract so that 50% less energy is needed to take out the cataract. And what that means is quicker recuperation, quicker recovery, and a quicker recourse of getting better vision.
So if you're trying to decide between this more traditional surgery and laser surgery, why would you choose one over the other? I mean, I think I would choose the one that's a quicker recuperation.
And when I present this to my patients, that's what they all say. And I say the real issue is that there's sometimes cost. So Insurance companies, Medicare, all the different insurance payers pay for cataract surgery removal. What they don't pay for is the use of a laser. So if you want the laser to help assist in the surgery, there are some out-of-pocket fees with that.
Okay, really interesting. So you are going to stick around, yes?
Oh, yes.
Yes.
Nowhere to go.
We're going to be talking about dry eye next. Okay. Dr. Mann is going to join us again. We're very lucky later in the show to talk about dry eyes, another common eye issue. But before that, we're going to talk to a woman who was diagnosed with cataracts. Her story when we return. Welcome back. Today we're talking about eye health and some of the most common eye problems. Joining us now is Ellen Dorey-Schmidt. Ellen's vision was deteriorating. She thought it was just a part of getting older, but it got to a point where she couldn't ignore it anymore. The diagnosis? Cataracts. Thanks so much for being here, Ellen.
Thank you.
So what was going on? What were some of the symptoms when this was first starting?
Well, I would say it's probably about 3 years ago. First of all, the doctor told me I had the beginnings of cataracts, so I really didn't have any symptoms that I was aware of.
Oh, really? So you went into the doctor and you were told?
Right.
Were you concerned? Were you shocked? Were you scared?
No, I wasn't surprised. I'm getting older, and my mother had had her cataracts done too, so it wasn't a surprise. And
But no symptoms leading up to it.
Well, I noticed I was wearing reading glasses. That's the only thing I needed to do, and I noticed that my focus was becoming worse, and I needed to increase the magnification of my glasses. Where I was starting at about a 125 to read, I had to work up. I was about a 250 by the time I realized I was having trouble. Then also at night, I was seeing halos around the headlights and spikes around the streetlights. So
okay, so there were
it was
some
getting
signals.
there. Yeah.
And had you not gone to an eye doctor for a while?
No, I had been going on an annual basis.
Okay, so you go, you get the diagnosis, and then I assume you were presented with a couple of different treatment options.
Correct, yes. I was told that I could have the laser procedure done, or I could have it done manually.
So when you were deciding between the different treatment options, laser surgery or the more standard surgery, how did you make that choice?
Well, my doctor explained the differences to me, and he also gave me written literature that I studied and compared. And the laser way is not covered by Medicare. The standard way, however, is, so that's one of my options. But then it was explained to me that the laser would give me better results, even though the standard way would be good, but the laser definitely was preferred. So
quicker recuperation?
I'm not sure the answer to that question because I didn't have it done the standard way. I just know that with the laser, it was very fast. Procedure itself was very fast, and my improvement was almost instantaneously, and I was quick recovery.
So you went with that. Right. And how soon after that procedure did you notice a difference?
Oh, pretty much instantly. It was amazing.
Really?
Right. You go home with a shield over your eyes, so you really can't see. Then in a few hours, you start your drops. As I removed the shields, I was starting to think that I was seeing a little better. And then I remember definitely the next morning when I had to drive to the post-op checkup, I was driving there noticing there were actually leaves on the trees, things I hadn't, everything was so super clear. It was like somebody washed the windows.
So really just the next day?
Yep, that quickly, right? It's like amazing.
What was the recovery time like?
Very short. The only thing you have to do is wear the shield for a week just to protect your eye at night.
The shield, what do you mean?
It's a plastic, fits over your eye, piece of plastic, hard plastic that's held there with tape. Just wear it at night as you're sleeping so you don't really press on your eye. And then it's drops. I'm still in the process of completing my drops, but it's about a month later, you continue with drops. And the next day I was driving, so there's really no recovery time.
How long ago was the surgery?
January 10th, I believe. Yeah.
Okay, so it's not that long ago.
Right.
Yeah.
Mm-hmm.
And how would you say your vision is now?
Every day I feel like it's improving a little better. It just becomes clearer. And my doctor had told me that it would, over time improve. So.
Do you still need reading glasses?
I do. But amazingly, the first day after I had the second eye done, I started reading on my iPhone, and I lifted up my glasses and I said, I couldn't even read without my glasses. So
Oh,
it
wow.
was that well. I mean, if I have to read for a long period of time, but I've dropped back from the 250 to the 125. So
And 250 to 125 is what?
that's the magnification that I was using to read.
So right now, so do you have anything in your eyes right now?
Anything in
Like,
my
like,
eyes?
are you wearing
Just my
contact
new
lenses?
lenses.
Right. But you're not wearing
no,
contact.
no contacts.
You don't need
no.
contact lenses.
No,
or,
no.
Yeah.
No.
Okay.
So,
And you see me clearly.
I do.
Yeah. And what about when you're driving?
Fine. Yeah.
Really?
Nighttime, I still have a little issue with the halos and the spikes, but my doctor said that should improve too over time. So,
And what would you say to someone who's just been diagnosed with cataracts and maybe is feeling scared, nervous, anxious? Oh my God, I'm not going to have good vision anymore.
right, well, I can just tell them my experience was nothing but positive and not to hesitate. It's painless and just a little hurting your pocketbook, but other than that, it's something that you will never regret. That you'll see better than ever. It's
And it's so important to be able to
the
see
lights.
clearly.
Yeah, of course,
Oh my
of course.
gosh.
You only
Makes
have
all the
that.
difference in the world.
So I'm very pleased with my results with the laser.
I want to thank you so much for being here.
Well, thank you.
Coming up next, dry eyes. It's a condition that's becoming more and more common. You might have it and not even know it. That could be me. When we come back, Dr. Eric Mann will be joining us again, and he's going to show us how to test for dry eyes. We'll be right back. Welcome back. We've been talking about eye health. As we learned earlier, dry eyes is becoming one of the most common eye issues today. We're seeing more commercials about it too. But what is dry eye exactly? And how do you know if you have it? We're joined again by Dr. Eric Mann to tell us more about it. Thanks for coming back.
Thank you.
So you brought a device here today that doesn't treat dry eye, but it diagnoses it, yes?
Correct.
And what is this?
This is a tear osmolarity test. And what that means is it's a test that measures the salt content of your tears. So basically, without any pain, we take a small little sample of your tear film, and we're able to measure how much salt there is. And depending on what the numbers are, it can tell us if you have no dry eye, mild dry eye, or severe dry eye.
And if someone has severe dry eye, then what do you tell them to do?
Well, we work together and come up with a game plan because it really needs to be treated.
If you don't treat it, what happens?
Well, the tear film is extremely important for coating the eye, to protecting the optical clarity of your cornea, which is normally a very clear piece of tissue, and it also helps to prevent infections. So if you don't have a good tear film and your eyes are dry, you're more prone to getting eye infections. You also can get little micro scars on this clear cornea, which over time could affect your ability to see clearly out.
So worth getting this checked out.
Definitely.
Do most ophthalmologists have these?
Pretty much most people do. It's important to get for dry eyes to be tested, and in today's environment, more and more people are having it, so it's becoming more of a concern.
So we have a couple of viewer questions today, and I wanted to ask you a couple if you're
Sure.
game. So one of them is from Gina in Brooklyn, and Gina says, are cheap reading glasses, the ones that you can pick up at the drugstore, okay for your eyes?
I get that a lot because
Really?
they're cheap and they're effective. But for the most part, they're not a problem at all. As long as each eye has a similar prescription of needing something for reading, they should work fine. It's when the eyes have different prescriptions and they only have the same prescription in each of these over-the-counter glasses that you could strain and get some headaches from.
What if you buy the glasses that have no magnification, but you're just wearing them because you want to look hip or you want to look smart?
Perfect fashion sense, not a problem at all. Just make sure that the lenses are clear, that they don't have little smudge marks on them, that you're not looking through with only one eye, and at the end of the day, getting dizzy or getting headaches from that.
Okay. And the next one is from Miriam in Manhattan. And Miriam says, is there a correlation between our diet and our and our eye health?
Tremendously.
Yeah.
So yes, talking about dry eye, fish oils are very important, good supplementation, and eating healthy fishes like salmon, which have good fats in them to help us keep our eyes hydrated and get a good tear film. Also, a big disease among older patients is age-related macular degeneration.
Which is really serious.
Really serious. It can affect your central vision and can make you basically not be able to function if you can't see. So there was a study done a few years ago with a bunch of farmers out in Wisconsin, and they studied the things that they ate, and they followed the progression of macular degeneration. And by taking a certain supplement, which is called the Age-Related Eye Disease Study number 2, because it was the second one they did, the AREDS 2 vitamins actually has shown to slow down the progression of macular degeneration by 50%.
That's remarkable.
Yes.
Yeah.
And a lot of these things that are in these supplements can also be found in dark green leafy vegetables, spinach, kale, escarole, very important stuff.
So overall, if we want to take really good care of our eyes, what do we need to remember to do?
Well, first thing, I think something that we could all do is wear sunglasses. UV protection. The more UV protection we have, the slower those UV rays are going into the eyes, which can progress cataracts and macular degeneration. A second thing is go to your eye doctor, okay?
Especially if you're a woman.
Especially if you're a woman. You know, it's so funny you say that. Most of the time, women are great at taking care of everyone else in the family, and they often put themselves last. And if they can't take care of themselves, then they're not going to be there to be able to take care of the others.
Mm-hmm. Thank you so much for being here.
Oh, my pleasure.
Yeah.
Thank you.
It's a pleasure. That's our show for today. So for all of you women out there, remember to take care of yourselves. Get your eyes checked for your health and for the benefit of everyone else around you. Till next time, here's to your health.